Generally, this is the question why every husband shows up with his wife for our first prenatal visit. Is it safe to have sex with my wife when we're pregnant? And as a general rule, absolutely yes. There are always exceptions to every rule in pregnancy. Doctors will sometimes tell patients who are spotting or staining in the first trimester to abstain from all sorts of activity. So someone who comes into us staining, spotting will say don't exercise, don't have sex, don't do this. The actual truth of that is that people who miscarry because there was something inherently wrong with the pregnancy from the beginning. Normal activity does not make people miscarry their pregnancies, but we sort of have gotten into the habit of telling people not to do things because people blame themselves and look for reasons why miscarriages occur. So if someone is staining or spotting, we have them rest and take it easy. So if something bad happens to the pregnancy, they don't feel that they were somehow accountable for that. But the truth is, with a healthy pregnancy, all normal activity is fine. You can exercise, you can have intercourse, you can do all your normal activity, and you will not cause a miscarriage to occur. Now, contrary to that, if a pregnancy is a high-risk pregnancy, if there's preterm labor, and that can be starting in the second trimester, usually after 21 or 22 weeks. If someone has a placenta that's low-lying, what they call a placenta previa, or there are other high-risk complications, multiple gestation, there are certain types of pregnancy complications that can put someone at risk for preterm delivery. Under those circumstances, we might have people refrain from certain activity. Intercourse can stimulate something called prostaglandin release. There are prostaglandins in semen, and that can trigger preterm labor because prostaglandins are involved in the initiation of labor. So we do sometimes have people refrain from labor or certain types of intercourse or certain types of sexual behaviors that may trigger labor or soften the cervix. So again, it's variable, but in a low-risk, general normal pregnancy, it's absolutely fine. But again, if there's any question with patients, we usually have them talk to their doctor, especially if they're high risk.